Dr. Burchett. Your daughter asked me to make a video for you. You've been through a lot. I understand. You've had a surgery, an intestinal surgery. You were recovering from that. Then you got a blockage, another surgery. It's just been a rough go in the hospital. Probably feels like you've been in the hospital forever. And I've done this stuff a long time, 20 years. Been with patients through a lot. You're in the trench. You're in the trenches, you know. Um, let's just go right to it. It sucks. It sucks to be sick. It sucks to be in the hospital. It's hard to be sick, especially for people who are active and out living their life. And so I'm sorry. I'm sorry you're going through it. It's not right. I'm sure your team of nurses and doctors and everybody's trying to get you through this as best you can. Let's just talk about the first thing right off. From what I've heard, again, from what I understand about everything, this is not something that's going to take you out. You're going to survive. Okay, you're going to get through this. Now, as you've already seen, it's not a short road. It's not a quick fix. You don't go home in a day sometimes. The road can be long, but we get people through it. And you try to minimize these bumps and setbacks. Sometimes it's a step forward and it's two steps backward, and it's a step forward and it's two steps backward again. But week to week, you're taking more steps forward than back. It's a marathon. Some of these recoveries are just marathons. So get it out of your, and people are afraid, like, am I going to die? Is this it? Am I going to die of this stuff? And the answer is no, you're not. You're going to get through it. It's going to be hard, but we're going to get you through it. So let's just start there. This isn't something that's going to kill you. Um, so in that sense, you're going to be okay. Now, um, there's all of these things that can happen that just make it longer, that take it longer to recover and to get better. And these things are big deals. These surgeries are big deals. Let's talk about intestinal surgery for a minute. When surgeons get in there and if they remove part of your intestines or they're in your belly and they're, messing around with your intestines, the large and the small intestine, they get stunned. They can get they go dormant. They go to sleep for a while. And it's normal for this to take days for them to kind of wake up and to start moving food and fluid and get back to normal. That can take a while. And especially if you've had a blockage and you've had surgery to fix a blockage, it can take some time. So typically we wait. We wait until they start to wake up. You start to feel a little hungry, then we give a little liquids. You kind of advance the diet a little bit at a time till you're doing a little bit more and more and you're back to your regular diet. And that could just take time, but it happens. You're not going to lose all your intestines. It's not the case that you're never going to eat again, or you're going to be eating through a tube, or you're going to be eating through, IVs. I mean, sometimes we have to do all that crap to get somebody through it. But again, um, these are bumps in the road, and you'll get through it. We'll get you through it. Um, so you're going to survive. You'll get through these things. And there's all these other little things. You get little urine infections, and there's just all kinds of crap in the hospital. So we want to get you out of the hospital as soon as you're safe. The bigger picture of this is uh, it's going to take some serious work on your end to get back to where you were before this hospitalization. Because the hospital, when you're in bed and you're laying in bed all day, you just get weak. You lose that muscle mass because you're just laying there. And so the bigger question really that is going to emerge when you get through all this is, what kind of shape are you going to be at the end? Like, how weak are you going to be? How much are you going to recover once you get through kind of the initial recovery from surgery stuff? And that's just all about how much you getting up and walking and doing the physical therapy and getting stronger and doing it a little bit every day and pushing farther than you want to go every day. for a long time. We're talking weeks, weeks to months. The good thing and the bad thing about both of this is that that part is within your power and your control to get better and to get stronger. You're not paralyzed, right? This is something where you were up here to begin with, you got knocked down with surgery. How far back are you going to get? Shit, you could get stronger than you were before. That'd be a lot of work. You could. You get knocked down. I'll tell you what happens. Guess what happens if you do nothing? You don't even stay here. You keep getting weaker, and we know where that goes. That goes into a nursing home and a wheelchair and all of that. So you got to get your ass out of bed. Again, when you're past the surgical stuff and you're out of, the few days after surgery, but once you can get up and get walking and get moving, you got to start working and pushing every day. Whatever they tell you to do more. Get up, get walking, get moving, get stronger. Like here's where you started. You're down here now. You're gonna get back. Where do you want to get back to? Where do you want to get back to? Get your ass out of bed. Get your ass out of bed. Would really encourage you to, um, once you can, put in the work, to to get back to it. You know, this is your life. This is your function, and your well-being, and your happiness. And everybody, the more active they are, the stronger they are. The more they get back, the better. So put in the work to that, and don't be afraid to ask people to help. Don't be afraid to. This is a team thing. You got a lot of people that care about you. Um, be very clear about what you need and the support that helps, and people will show up for you. They want to be there to. This is the rally. And it's the most important stuff, which is you and your life, and um, people will be there. Be very clear about what you need, and thank them, and um, everybody's always on the same page and wanting you to recover and to get better and to get back to it. So don't be afraid um, to ask for help and encouragement through this. It'll help you go farther. So you're going to be okay. All right. You're going to get through this. Um, I understand you've survived a lot to this point. So um, I know you're tough. Thank you for your service. You're going to need to draw on some of that toughness to get through this. And you know that. But it ain't going to kill you. You're going to get through it. It's going to be a marathon. It already is. That's just what we're dealing with. Um, but I am sure that the doctors and nurses and everybody, we will always be there for you to get you through this. We will always be there, right there with you, you know, to really do this thing together. That's what we do. So hang in there. You know, you take it day to day. All you can do is today. Don't think too much about weeks and months and whatever. You just focus on the day. But when you look back and measure your progress, like I said, sometimes it's a step forward and it's two steps back, but week to week, you ought to be walking more, eating more, getting stronger. Week to week, you ought to see some progress. You know, that ought to be encouraging. Get a little bit stronger. You can walk a little bit farther. You do a little bit more every week, and then you start to see and believe, you're recovering and you're going to be okay. I know what it's like. I've had countless patients. I've been one myself, and you have these moments where it's the worst. You're stuck. You're stuck in that bed. You can't do shit. You feel terrible. You feel like you're gonna die. You can't eat. You can't get up. You can't. You're just trapped and stuck. And it's you got to remember this isn't forever. You're in the trenches of recovering from something big, and there's just every cell in that body and the human spirit wants to get better, and it's all that's what it does. People just heal. So um, you will recover from this, as hard as this is, and all of the feelings, and am I going to die, and all of that stuff is, it's just, that's part of the deal. and we'll get you through it. You're going to be okay. So um, hang in there, go day to day, and get your ass out of that bed and get stronger and better. And I think you still got a lot to live for. All right. Good luck and keep me posted.